I'd like to speak to you today about the first black surgeon in Alton, and he was also my first family doctor, so I'm a little dated there. His name was Dr. Clarence P. Horton. He was born in Roma, Georgia in 1910. He received his education in the Pittsburgh, Pennsylvania school system and at the Bluefield State Teachers College in Bluefield, West Virginia. He graduated from Meharry Medical College in Nashville, Tennessee, and served his internship at Homer G. Phillips Hospital in St. Louis, Missouri, and did his surgical residence at the People's Hospital, which was also in St. Louis. After completing his residency, Dr. Horton has offices in East St. Louis, and Alton. Dr. Horton was an exceptionally talented surgeon, but he had to become a general practitioner to pay his bills. At the urgent in his practice, so he quickly learned to add folk remedies such as how to use mustard poultices. A poultice is a hot cloth or bandage soaked in something that's applied to the skin. It was used for congestion and pain for arthritis. He also used onions to break high fevers. We know them today as allium, onions and garlic. They have potent arthritic inflammatory properties. So they were incorporated in a lot of different folk remedies. Combining folk remedies with his new medical remedies added real value in allowing patients to become comfortable with him as a young new doctor. A large number of his patients were blacks and poor whites who were either underinsured, had no insurance, or had very little money to pay him. So he often took food and services for payment. As children, the Horton kids remember eating the best fresh vegetables and absolutely the best pies and cakes ever. Once President Johnson's new society bill produced Medicare and Medicaid, his income vastly improved. Like other doctors, Dr. Horton made house calls because his patients weren't allowed in the Alton hospitals. Most black doctors became highly skilled largely from treating trauma patients on a regular basis and being resourceful. Remember, Dr. Horton did his internship at Homer G. Phillips Hospital, which was known for gunshot wounds, ulcers, and burns. Today, we call this a trauma center. Dr. Horton was an exceptionally talented surgeon. This one person said his family was in a horrific accident and they had to wait in the emergency room until Dr. Horton arrived because no one else knew what to do. The Horton children bore witness to this because people would stop them to say how their father saved their lives. Doc's daughter said that her dad would laugh and say he got called in to do the fun part. Initially, Dr. Horton was not given surgical privileges in the Alton Hospital. His talent became so well known in the Alton medical community, white doctors would call on him while they were in the middle of surgery, once they realized they didn't know what to do or how to complete the surgery. Dr. Horton was then called in to complete the surgery. Now get this, during a surgical procedure, when the white patient would be put to sleep, they would see their white doctor. And when they woke up, they saw their white doctor, never knowing it was Dr. Horton, a black doctor, that saved their lives. His black hands were in their white bodies, making everything right. The surgical staff would tell these stories from the operating room. Now, all that changed in the early 50s when he turned in his resignation to the hospital. He knew that the white doctors did not know want to take care of blacks or poor white patients, and they couldn't function without his surgical skills. When the board asked him why he was resigning, he said, "I could not practice in a place that treated his patients like second-class citizens." Eventually, Dr. Horton obtained hospital privileges at Alton Memorial, St. Joseph, and St. Anthony's as a visiting surgeon. He was integral in their daily function, but they still didn't give him full privileges or the proper recognition. These are articles published in the Journal of the National Medical Association on surgical procedures that Dr. Horton co-authored, and his title was Visiting Surgeon. While at the hospital, Dr. Horton started a methadone program for the treatment of drug addiction, served as a member of the Board for Mental Health in Madison County, a member of the Executive Committee of the Greater Alton Association of Commerce, the GAAC, and chairman of the St. Joseph Emergency Medical Service, and was on the Law and Order Committee. He was also a Madison County coroner for a short period of time. Dr. Horton served as a member of the International College of Surgeons. He retired from practicing medicine in 1990, and he died in 1998. If Dr. Horton would tell you, he originally had no desire to become a physician. He was a high school 3-letter athlete, baseball, basketball, and track, and he wanted to become a teacher and a coach. Outside of medicine, Dr. Horton played in the Negro Baseball League and was an avid golfer. And he was part of the Alpha Phi Alpha fraternity. He was also a 33rd degree Mason of the Prince Hall Masonic Order, so he wasn't all work. Just like all the doctors of Alton, there's so much to be told of them. There's no way you can capture it all in such a short time. Dr. Horton was the real essence of a man that had such great talent, the heart of a lion, and took care of generations of people. Remember, some people operate within the system to bring about change, and others kick the doors down. Dr. Clarence Pennington Horton was a kick the door down kind of man. I get emotional because he was my doctor.